Well, today we have Dr. Anjali Bhosle and she's practicing in Mumbai, Maharashtra. We're going to be talking about OAB and also we are going to cover the UTI for the young females we have out there. Very welcome, ma'am.
Thank you so much.
So the very first question which comes to my mind when we talk about OAB is what is an OAB and how we get to know that we might be having an OAB?
OAB is a short form for overactive bladder.
Okay.
And overactive bladder means a patient will have an urgency, or even if she leaks a single drop of urine, that is called as urge incontinence. It is a continuation of overactive bladder. So anywhere where the bladder is functioning without, when it not supposed to be, that's an overactivity that is seen.
Well, is it a curable thing or we should just live with it? Because there are people who think this is the matter of the age and it has to come.
No, it's just a myth.
Yes.
Yes, of course it's curable and you must treat. So whenever you have symptoms like you have frequency or you have urgency that you cannot control urine, you should approach a urologist so that they will work you up, see you, examine you, and then treat you accordingly, give medications, do a few investigations beforehand, and then treat you.
Wonderful. So for the young females we have out there, I would be asking you, what is an UTI and how we tackle it when we have an UTI? How we will get to know that we might be having it?
Urine infection is known as UTI, urinary tract infection. It consists of symptoms like burning sensation, having increased frequency, again urgency, nighttime frequency, and sometimes high-grade fever if it is not treated in the early stages. Females are more common for urine infection because the urinary opening is more near to the rectal area in the perineum, and plus the urethra is very small. So once or twice episodes of urine infection in a female is quite commonly seen. But if it's going to be a recurrent one, you must not neglect and approach a urologist.
What could be the reason of a recurrent UTI?
It is most of the time the local area, that is the vaginal infections or constipated patients, plus any vaginal leukorrhea, the vaginal itching, white discharge, plus the more important thing is holding on urine for a longer period and drinking less water. So the urine becomes more acidic. The acidic the urine, more infection chances. So you must drink plenty of fluids, have more of lemon water, more of alkalinizers, and flush out urine at regular intervals.
Well, if in case we want to avoid having UTI, what precautions or what thing we can do to avoid it?
As I rightly said, that you must drink plenty of water. Now, plenty of water means at least 8 to 10 glasses per day, that's the minimum. The best way to drink is 1 glass before breakfast, 1 glass after breakfast. So breakfast, lunch, your evening snacks and your dinner, this amounts to at least 8 glasses per day. And plus in between your buttermilk, your lemon juices, the other forms of liquids will count to 2.5 liters per day.
Well, there are times when someone is suffering from UTI and she is feeling a burning sensation and she wants to go to the washroom very frequently. Is there any instant solution or what she needs to do at that particular point of time?
Yes,
she should getting irritated.
Yes. There are few medications which will relax the bladder, but that's only on the temporary basis. You must get the urine checked and then start antibiotic if there is a high infection.
So you have to consult to a urologist as soon as possible.
Of course. No home remedies.
Any take home message you want to give to the viewers watching this channel?
Exercise regularly, drink plenty of fluids, have a good balanced diet, not to hold on urine for long, and alkalinizing the urine is important. So have more of fruits, fruit juices, buttermilk, lemon water.
Wonderful. It was really amazing having a talk with you, ma'am. Thank you so much for being here.
Thank you.